I'm Dr. Adelaide A, and my session will include things I want you to know about pediatric patients and pediatric care. I'll start off with vascular lesions. We have two therapies that I think are front and center that I want you to be aware of and to use thoughtfully. First would be topical timolol, actually a drop for glaucoma that is placed in the eyes, but we place it actually on early hemangiomas or small hemangiomas with great efficacy. We do this twice a day. It's readily available on most insurance plans. Very cost-effective therapy. The earlier you start therapy, the better. The only caution is do not put this agent on an ulcerated hemangioma because timolol can be absorbed. The reason we don't have timolol as one of the beta blockers for hypertension is that it's too effective and the patient's blood pressure could go down. So as long as the hemangioma is intact, it's a great therapy. Start early. Second thing, let me compare for you if you have other hemangiomas that are larger or of greater concern or multiple, you want to use a systemic propranolol. And in this case, I want you to understand the differences between a branded FDA-approved product and the generic product. First and foremost, our branded product comes in only one concentration, so the druggist is not going to make errors in terms of filling the prescription, especially since you need to send this to a specialty pharmacy. Indeed, this medication lacks sorbitol, which can cause an osmotic diarrhea. No mother or father is going to give their child a drug for a year if they continue to have diarrhea every time they take the medication. So think about that. In addition, the sugar is taken out and saccharin has taken its place. This reduces the likelihood that the child will have a craving for sugar later on, although that's not an absolute promise. Another arena within the vascular anomaly space is a lesion called a Caposiform Hemangioendothelioma. Now, while this is rare, I do want you to be aware of it because we have a treatment in sirolimus. This is a drug that is used by our hematology oncology colleagues, and we have one on our vascular anomalies team who actually does the prescribing. This is a miracle drug, I can tell you, for these patients who have these early vascular lesions that actually can be life-threatening. So keep that in mind. If you're not certain about how to manage this patient, have a vascular anomalies team give you assistance in doing so. And last, I'm very pleased to tell you that there is a drug that's been around for a while to actually treat breast cancer in men or women that is now used for overgrowth syndromes. Many of these children have vascular tumors related to the PIK3CA gene, and this is the basis of this therapeutic intervention. We use alpelisib to reduce both pain, but also to actually physically reduce the overgrowth. This is an amazing addition to our armamentarium, and we are so pleased to have it. While these last two conditions are somewhat rare, you'll really look sharp if you know about them and you get this therapy for the patients for whom you provide care.